Hi, I'm Dr. Matt. Today I want to talk to you about breaking the cycle of joint pain and preventing osteoarthritis from developing. I find that there's three mistakes that people really make, or maybe I should say three misconceptions that are out there today, okay? So the first misconception or the first mistake that people are making, number one, is they're treating their joint pain with medication. So think about this. If you have joint pain, what's the first thing you do most of the time? You go to the medicine cabinet and you look for an anti-inflammatory and a pain reliever, okay? Well, this way of thinking has become a huge problem in our country today. Right now we've got 76 million Americans that have chronic pain. Some of this is contributed to the fact that we have covered it up and masked our pain in our joints for years, okay? Now, will that medication take away the pain? Absolutely. Most of the time it will, okay? The problem is that when that wears off, what happens? The pain comes back, either the same or more intense, because the joint has actually degenerated and gotten worse as time has gone on, okay? Which is why, number one, I say the biggest myth or mistake that we make today is we cover up our pain with painkillers, anti-inflammatories, and so forth. This only leads to a progressive degenerative problem that develops within the joints, okay? Because the root cause of the problem is never addressed, okay? Number two is that you're really going to the wrong providers to handle chronic joint pain. Here's why, okay? The literature shows that 80% of joint pain that's out there today is not anatomical. There's not an anatomical lesion, meaning this: there's not a torn ligament, there's not a bad disc, there's not a torn meniscus, there's really nothing broken, nothing you're going to see on x-ray or films, okay? Which means that nothing is diagnosable, nothing is medically necessary there. So a lot of times doctors will send you on the way, give you a pain reliever, an anti-inflammatory, because you have pain and there's actually something there, but they can't find anything, okay? So this then leads us into, well, what could it be? Well, chiropractors for years have been saying that there's this biomechanical issue that's happening within the joints of the body, knees, back, spinal joints, shoulders, and so forth, that begins to happen. This starts to create degeneration happening within the joints. The joints begin to wear down and therefore start to lead to pain. Most people, when they have joint pain, they don't have it as a result of some acute injury, some sports injury, some auto accident, some fall, or something like that, okay? Where they're getting this pain from is the chronic repetitive motion over time on joints that are not biomechanically sound. They're not strong. They're not tracking correctly. For example, okay, let's take an automobile, for instance. Let's say one of your tires is just slightly flat, okay? One of your tires is just slightly flat, and now you're starting to drive on it. You may not notice any change happen at all, okay? But over time, your wheels start to become unbalanced, your axle becomes a little unbalanced, and we start to see bigger problems develop. Same thing happens with a joint, okay? What's interesting here is, let me make sure I get this correct, the International Journal of Rehab actually surveyed doctors, and the report was that 92% felt that they were not sufficiently trained in musculoskeletal conditions. So when I say the second mistake that people are making with their joints is they're going to the wrong providers. They're going to providers that don't specialize in biomechanical problems within the joints. 80% of joint pain is biomechanical. There's not an anatomical lesion, okay? So who's the best provider for that then? Well, what the literature is showing is that chiropractors are actually the best at looking at and identifying biomechanical issues within the joints. That's what all of their training on is biomechanical changes within joints, as well as some pathologies and physiology and, you know, physics and x-rays and things like that. But a huge component is the biomechanics. The third issue, the third mistake that happens today, okay, is this. When the pain in your joint goes away, are you better? No, you're not better, okay? Just means the pain has gone away, but the joint still may be unstable, okay? The joint still needs to be maintained throughout your entire life. It's not just for that period when you're in pain, but it's your entire life. Joint pain and osteoarthritis, okay? Osteoarthritis is a degenerative problem that happens within the joints. So, if osteoarthritis is a degenerative problem, now let's take a look at all degenerative diseases that we have today, from high blood pressure to high cholesterol to diabetes to inflammation within the body. All degenerative diseases that we have today must be managed throughout your entire life. Just like weight and losing weight. Let's say you had to lose 40 pounds, okay? Could you just go and exercise for a few weeks, get the 40 pounds off, or maybe 10 weeks, eat well, exercise, get the 40 pounds off, okay? Does that mean you can go back to your old habits? Absolutely not. You must begin to maintain and change the actions that got you into that degenerative state to begin with. And that is one of the third problems that we have with osteoarthritis today, and why it develops is because it is not maintained properly over the lifetime of that individual. So here at our office at LifeWorks Integrative Health, we take a much different approach, okay? We actually have a 4-step approach to chronic joint pain, osteoarthritis, and correcting the biomechanics, okay? First, our nurse practitioner, she specializes in reducing that pain and inflammation, because we know that's important to patients, because that's the main reason why they came into the office, is because of that pain. Number 2, our chiropractor adjusts the spine or those joints to help the alignment and the tracking of those joints, so there's not aberrant wear and tear and long-term stress happening within the joint. Third is, if you don't strengthen that joint after you correct the alignment, it's going to have a tendency to shift back out of place, which is why we add rehab into our treatment plans to help to stabilize those muscles around it. The fourth, and I love this one, it's actually regenerative stem cell therapy. Because let's say you have an arthritic joint that's already been developed. Well, what happens now? Because you don't want to continue to take the medication for it. You don't want to continue, or you don't want to get to the point where you actually need a joint replacement or knee or hip replacement. What you want to do is you want to help preserve that joint. So regenerative stem cell therapy is new technology that has, I shouldn't say new, the technology has been around for a while, but it's getting remarkable changes within patients' joints and regenerating and allowing patients to return back to either better or sometimes even normal function. So with our 4-step process, we help to change those 3 mistakes that people are making. If you need help, be sure to look us up at www.lifeworkskc.com and look for more videos on these types of topics.